How much of what is in this study is relevant to the South African context?
Tamikela, thanks very much, and good afternoon to the viewers as well. Well, we have also seen this decline in the number of birth registrations. If I can just point out some of the data, in 2013, we had 1.15 million births registered by Home Affairs in South Africa. And if you fast forward to 2017, we had 989,000 births registered. So you can see there's been quite a significant decline in the number of births registered. And if you look at the fertility rate in South Africa, you can see the same pattern with the number of children born to women between the ages of 15 and 49 declining from 2.68 in 2009 to 2.4 in 2018. So both types of statistics gives you the same conclusion, that there are fewer children being born to women between the ages of 15 and 49 each year over the last decade.
The study, Dr. Pillay, says that most of, or at least the major reason for this drop in birth rates is because women in developed nations like the United Kingdom no longer have to deal with bearing children as the main priority. A lot of them are working or doing other things. Is that the reason in South Africa, or are we seeing more of a health complication as the reason why we are seeing fewer births?
Well, I think there are a number of reasons in most countries, but in South Africa, I think the following reasons, Mbikela, can account for this decline in birth rate. So the first is that education levels have increased. So the number of, especially women in school, in high school, completing high school has increased over the last 20 years in South Africa. Secondly, departments of basic education, social development and health have introduced what's called comprehensive sexual education as part of life skills education in schools, starting from primary schools through to high schools. In the Department of Health, we've increased access to contraceptives, and there's increased awareness now of the need to contracept and family planning. And then, of course, it's the economy, as you point out. As the economy grows, as people move up the economic ladder, people have fewer and fewer children, largely because, as well, women enter the workforce. So the more women that enter the workforce, the fewer the children are born. And women then, of course, conceive much later.
Tell me this then, Doctor, if a low birth rate is such good news, or is such bad news at least for the developed world, why is it bad, so particularly problematic in poorer nations?
So it's only a challenge where the birth rate is so low that you don't replace those that die. And of course, then you get a negative birth rate, and therefore the population growth then as a whole declines, and you don't have people entering the workforce given the number of people that die. So that's where it affects the economy. But in low and middle income countries where the birth rate has historically been high, this is good because it's good for the economy, it's good for individuals, and it's good for women to have fewer children. And it's good, of course, it's good for the community. And that's why it's good for low and middle income countries. But if the birth rate is lower than the death rate, as is the case in many developed countries like Japan, for example, then you have fewer people entering the workforce and, of course, fewer people being productive and then generating the wealth of the country. And that's where it becomes a problem.
Is it correct, Doctor, to read this report to be saying to the developed world, go out there and make more babies?
Well, yes, in terms of maintaining the productive forces of the country, you will have to have a birth rate higher than the death rate, clearly. But what we need to understand is that the birth rate needs to be commensurate with the amount of resources there are in a country to really take care of children. In Africa, more than 60% of the total population is under the age of 15. And, children need to be in school and not be in the workplace. So we need to ensure in developing countries that we have the resources to take care of our children and not to force them to go too early into the labor market. And the same applies to the developed countries. They need to ensure that their birth rate is commensurate with the number of people they need to continue to generate the wealth to take care of the elderly. Because if there are too many elderly in the community that are retired and need to be taken care of and provided for by the younger people who are paying taxes, then they have the reverse of the problem that developing countries have. So we need to have a balance between the birth rate and the death rate.
From this report, as I understand it, 2.1 is being put as the ideal birth rate, especially if we want to bring global population numbers to a stable level and indeed decline them. So would it really bring an end to those fears that we've heard in the past about overpopulation globally?
Well, you remember that, historically, families had between 10 and 20 children. Now, as the fertility rate declines, you see that number coming closer to 2. And that's really what the 2.1 refers to, Thembekile, that most families then would have, on average, 2 children. If it drops to 1 and below 1, that's where you have the problem of not being able to replace the population that's dying. So 2.1, 2.2 is a good number to have for as an average for the whole world.
Dr. Jürgen Pillay, here is to welcoming more babies into the world, I guess. Thank you so much for your time this afternoon.